Hi, I am Dr. Sumaira. I am the practicing consultant pediatrician and PICU specialist in a Motherhood HRVR hospital. I am here to share some informative bit about Omicron in children, isolation, treatment of mild disease, and vaccination and in adolescents. So we'll start with how the Omicron is presenting in children with mild diseases. So 90% of the cases what we are seeing in children is mild disease, like it presents like a flu-like illness like fever, cough, cold, anorexia, nausea, vomiting, abdominal pain, and the child will have recurrent fever for next 3 to 4 days, high fever, body aches and headaches, for which once you visit your pediatrician and the child tests positive and the pediatrician gives you symptomatic treatment and tells you there is nothing to worry and you can go and quarantine at home, then you have to be quarantined and isolated at home with the child. If the child is not less than, for example, if the child is a small child less than adolescent age, you have one caretaker should always be with the child. The caretaker also have to take all the COVID appropriate measures along with the child and has to be in the isolated room. The room should be well ventilated, and make sure that the caretaker is wearing a mask. For children less than 5 years, masks are not recommended. For 6 to 11 years, you can give mask, but the child should understand if he is under the parent's supervision, if he is taking proper precautions while using the mask, it's okay. But for 12 years and above, mask is compulsory like in adults. Second thing, whatever we are using, like during isolation, whatever you and your child is using should be disposable for the eatables, whatever the utensils and all you are using. Third thing, the surfaces should be cleaned with surface cleaners like your bed, your table surfaces. Third and the last thing, the linens and the whatever clothes you are using should go in a should be washed separately with your normal detergent. That is the regular precaution what you have to take. Apart from that, medical treatment, there is no specific treatment for COVID-19 as such. You have to give all the symptomatic treatment advised by your doctor. There is no role of steroids and the molnupiravir, what the new antibody has come up. So it is not recommended in mild disease and it is not recommended in children. Now let us come to the vaccination part. So for children 15 to 18 years of age, as WHO is recommended to start vaccination, which is already being started. So we are giving co-vaccine for 15 to 18 years of age, which is compulsory for all the adolescents to be taken. Less than 15 years of age, whatever immunization schedule is being followed, you have to follow the immunization schedule for your child. Do not skip immunization, because in case you skip immunization, you will be seeing more of the vaccine preventable diseases if we don't give the regular vaccines to our children. So that's all from my side. Hope this is helpful to you. Thank you.